don't need that leaving the body. We need to return it. So, I think in your textbook, okay, what you're going to see is that there are renal function tests. I won't ask you about a whole lot of those, but just look over that table in your textbook and be familiar with it, because you will see that in patient charts and so forth. So now that we have formed the urine, we need to now store it until we get rid of it. So in our body, one of the things about it, you know, unless a person has had like damage or something wrong with that posterior pituitary and the ADH production, okay? Usually, we do not constantly get the urge to go to the bathroom. And believe it or not, to go urinate is actually based on nerve impulses, okay? It's information being sent to the brain so that you get the urge to go urinate. So once we have the urine formed, by way of those ureters, they make it to what's termed the urinary bladder. They enter the bladder on the posterior side of the wall. Urine, as it moves through these ureters, it's peristaltic. It looks like it's in waves as it goes in. Contractions are taking place pretty much constantly under normal conditions, okay, moving the urine into the urinary bladder. And the urinary bladder is a muscular sac. What we're going to see, there is a portion, when you look at that bladder, and if this is the posterior side, where the urine is coming in from the ureters, okay, the structure of the urinary bladder, like through the middle of it, has this area that contains the detrusor muscle. It's smooth muscle. Therefore, under the control of the autonomic nervous system. The cell structure of the bladder is transitional epithelium. It's where the cells look like they can collapse and expand back out. And that's what they do. The structure is lined with mucosa because the normal pH of urine should be about 6. And even though it doesn't sound very acidic, it's a tad bit acidic, okay, for the urine. Depending upon anatomy, all right, the bladder can hold about 500 milliliters, all right, some more, some less, okay, before it actually gets the feeling or the need to eliminate. So like I said, it's going to be involving the nervous system for urination to occur. The urethra is the anatomy that passes urine out of the body. Here's the thing about the urethra. The urethra is controlled by an internal sphincter and an external sphincter. The internal sphincter is smooth muscle. The external is skeletal muscle. As babies are born and they begin to go through their toddler years and begin to be potty trained, that's the muscle that they're training, okay? Because that is the part that is the skeletal muscle for the opening of the urethra. With the sympathetic innervation to the bladder, what we're going to find is it allows for filling of this sac without the constant need to eliminate. So we're going to see that once you eliminate, what will happen is the sac actually goes flat. And because the ureters are still connected on the posterior side and urine is still moving through those ureters, that sac, as it continues to fill, will continue to move back to the rounded structure because the cells allow it to do that. So, because the external sphincter is somatic, skeletal muscle, okay, internal sphincter is the one that will become excited, meaning as the sac begins to fill, because the internal sphincter is smooth muscle, it's getting pressure put on it. Nerves are going to be stimulated, and you're going to get a action to the brain, and the need to urinate, micturition, is going to happen. It's called the micturition reflex, and that is the term you will hear out in the medical world. So, what we're going to find as the bladder fills up and pressure is put on this internal sphincter. Now the external, which is the skeletal muscle, this one is the one that you've trained to hold it in. If not, it would constantly leak, or you would be going all the time, okay? So as the pressure is put on this smooth muscle, we're going to get the information, the impulse, okay, sent to the spinal cord, to areas of the brain. You're going to get information back and feel the need to have to eliminate. That need you can control to a certain point. Okay? If you're drinking the great big huge thing, all right, you're on the road trip, you might pass by one exit and be like, oh, no, I'm good. Next exit, you might be like, should I or should I not? Get to that third exit, and it's like, oh, yeah, we got to stop. All right? So, at that point, we're definitely getting information about the need, all right? And we need to allow that to pass. Because the kidneys are busy, they do lots of filtration. Nothing else in the body can compare to the filtration of the waste that occurs, but they are also highly susceptible to lots of different diseases and other disorders of the body. One of the things that can happen when the kidneys begin to fail and there's no longer the filtration occurring that's needed, people may have to get dialysis. All right? Lots of different levels of dialysis, but the goal is to clear the blood of toxins. So they'll get hooked up to a machine. Anybody ever seen it done? Okay. Where were they? What?
Usually do it for on like one of the arms.
Okay.
And then they just put it in.
Have you ever seen the one that had to be hooked to the heart directly? Okay, cannot imagine what that feels like for the person. But yes, witnessed it, you know, with before my mother-in-law passed. And you have the lead, you know, the tubes going in, and it's like right here. I mean, I just can't really imagine what that's like. But the goal is to make sure that they take the blood that has the waste, put it through the system that cleanses it and returns it to the body. Now, sometimes when people are going into kidney failure, this starts out and very successful in the beginning. As deterioration continues, as the kidneys continue to fail, if other measures, such as a kidney transplant, don't happen, okay, the increase in frequency of having to get the dialysis and so forth gets more and more to the point where it may not even work anymore. Sometimes it can end up where they are hooked up to a machine at home and it's through their peritoneum, okay, they have to constantly be hooked up to a machine that's emptying somewhere, usually into the toilet somewhere. So the goal is to pass that blood through a selectively permeable membrane that's acting like the cells of the body, clearing it and returning clean blood to the body. But one of the things that will happen is you will definitely encounter people like, especially as we get older and other diseases have set in, people that are dealing with kidney disorders. So lots of things can go wrong.